what is MS? So I'm going to tell you what it is, what it definitely isn't, and what it might be. And we'd like to think that everything you read about MS is going to be very intellectual. This is Rodin's sculpture, The Thinker. But unfortunately, a lot of what you might read is not true about MS. So there will be a little section in the middle of my talk which is a word of warning about some of the misinformation that can occur. Now, we define MS as an idiopathic, that means it comes out of the blue for no known reason, inflammatory demyelinating disease restricted to the central nervous system. And really there need to be two features before we can call it multiple sclerosis. First, you need more than one lesion, so you need a minimum of two, and that makes it multiple. And it needs to be at more than one time, so two separate times. And thirdly, we're not able to find any other cause, because there are other conditions that can cause symptoms similar to MS, but fortunately we can usually tell the difference. And indeed, almost any kind of symptom can occur, and it doesn't matter where in the world you are when you get the disease. This is sort of from Western countries, and this is from Far Eastern countries such as China, Taiwan and Japan. And you can see that people with MS suffer the same kind of problems. They can get weakness, numbness, sometimes it can affect their bladder or their vision, either with blurring of vision or double vision. And there's these very rare, more severe symptoms. But it can cause other unusual symptoms. Very rarely, it can affect memory or mood, and also concentration. And perhaps up to 1% of people that might be their first symptom. There are also transient symptoms that can occur, that can come and go. And we may not always need to do anything about those, but the typical one would be trigeminal neuralgia, which is an extremely severe but transient pain, paroxysmal pain. And that can sometimes make diagnosis difficult because by the time the person goes to see the doctor, their symptom may have gone, or it might only be sometimes, and the doctor may examine them and not find the cause. Things like itching and numbness and pain, and this very long word here, which is just abnormal movement, they can also be due to MS. But it's also true that many people without MS might have funny itches or feelings from time to time too. So a very difficult time in MS is after people are first diagnosed. Whenever they notice anything, they will often wonder, well, is this my MS causing this? More often than not, the extra symptom they might be experiencing may not be MS. Could be something else. One of the first questions people ask when they're diagnosed with MS is, what kind do I have? Because they've all read about relapsing remitting and primary progressive and secondary progressive, and people say, what kind? Well, this graph is to show you that it's not quite that simple, because it's easier really to define as MS that's not causing much trouble, or MS that is causing a lot of trouble. Because if you look at, say, relapsing remitting, where people have attacks and then recover completely or almost completely between attacks, versus, say, someone with secondary progressive, where they might also have attacks but not recover as well between attacks, are they really so different? It's really a matter of degree. Sometimes we also find people with what seems to be progressive MS or primary progressive, meaning they're not having attacks, but we discover that 20 years earlier they had some symptom that they might not have paid much attention to. So does that make them relapsing patients who are now secondary progressive, or does it make them primary progressive? So these descriptions are just labels. They don't necessarily imply a totally different disease. And seeing that we have a very young member of the audience, which is a nice thing, and we're very happy to see, there's this perception that MS only occurs between the ages of 20 and 40. And of course that's not true either. It can occur at any age, unfortunately. The oldest patients can have their first attack at the age of 80, and people under the age of 15 can have attacks. And sometimes that leads to a delay in diagnosis, where an older patient might have some symptom and the doctor might not immediately think of MS because they think they're too old for a disease like MS, or sometimes it's not diagnosed because they think the patient looks too well to be something like MS. But like any illness, there's a complete spectrum of severity from the very mild to the more severe.